House GOP senators working through the night to hash out a new model of this health care deal before their deadline and everybody takes off for the 4th of July tomorrow. Avik Roy wrote the definitive report on how to get rid of Obamacare. Jonathan Gruber was the architect of Obamacare. They face off here next. Not to be missed after this. Anxiously awaiting a new version of the Senate health care bill, the one that Majority Leader Mitch McConnell is hoping, fingers crossed, he can get passed as far as he sees it. So the clock's ticking down. Looks more and more like they may be catching a plane before they're casting a vote. Watch.
I guess it's up to the leadership on the Republican side to decide if they want to fix things or just go down the path.
We're making some progress, but we've got to make more than we have. I'll put it that way.
We cannot be frozen out.
It'd be good to replace Obamacare because it is failing miserably, but if we can't do it alone, then it comes time to work together.
I want President Trump's campaign contract with the American voter to be fulfilled. Until we get there, I won't really know how I'm voting.
Joining me now, Avik Roy, the president of the Foundation for Research on Equal Opportunity and an opinion editor at Forbes, and Jonathan Gruber, one of the architects of Obamacare and an economics professor at MIT. Gentlemen, welcome. It's great to have both of you with us tonight. Avik, I want to start with you. You said that this Senate bill is one of the best pieces of legislation that you have seen in your lifetime. Why? And are they ruining it with these changes?
Well, I said if they pass it, it would be one of the biggest accomplishments, if not the biggest, by a Republican Congress in my lifetime. And that's because Republicans talk a lot about entitlement reform, but they have a real chance to do it, and to do it in a way that would actually make health care better for a lot of people. And so we'll have to see whether they're able to get that deal together and get those 50 votes. And it's a challenge because there are a lot of people in the Republican Party on the moderate side who may be kind of uncomfortable repealing Obamacare, and there may be people on the right who really are uncomfortable replacing Obamacare. They'd rather just repeal Obamacare and go home. And that ideological or philosophical difference is playing a role in the balancing act that Senate leadership has to work on today.
Yeah. Avik, staying with you for a moment. Rand Paul basically says it's a buyout for insurance companies. Why are we throwing money at insurance companies in the name of, quote, stabilizing the marketplace? They're not the people who need the money. What do you think about that?
Well, I don't think it's a buyout of insurance companies at all. I think it's about making sure that sick people and poor people can afford health insurance, which is a goal that Republicans, in my view, should embrace. That's the principle behind the report Transcending Obamacare that you cited in the teaser. My foundation is all about market-based approaches to universal coverage. That's what we should be working on. And I think the problem with Rand Paul is he doesn't believe in that. He thinks that it's okay for lots of people to be uninsured and that we don't have the money lying around to do it. We could. If we actually reform the healthcare system, reform entitlements, there's plenty of money to support covering the sick and the poor without spending more money. We can spend a lot less, cover more people.
Jonathan, what's wrong with what he said?
Well, what's wrong with what Avik said is that basically the market by itself cannot provide universal coverage. You're going to have government subsidies to make insurance affordable. So, for example, take the Senate bill. The Senate bill in its current form would say that a low-income person would qualify for insurance, which would have a deductible that's about half their income. That's not affordable insurance. Now, it would say that a low-income 60-year-old would have to pay about $6,000 or $7,000 in premiums for insurance for a deductible that could be a third or a half of their income. That's not affordable insurance. We can debate what's affordable, whether it's 10% of income, 15% of income, but we can't argue that an insurance product with a deductible that's half your income is affordable. So basically, what this does is it takes a huge amount of money away from insurance for low-income people and redistributes it towards a tax cut for rich people.
All right, so the CBO says
you can't shift that kind of money away from the poor to the rich.
The CBO says that Medicaid spending falls 35% over the next 20 years, Avik. So you have a different way of allowing the low earner to be able to have a deductible that they can live with, that gives them coverage that they can actually pay. How?
Yeah, so it's important to replace the Medicaid expansion in Obamacare with tax credits so people can buy private insurance. And I would disagree with at least some of the numbers that John threw out there in the sense that I think the premiums will be affordable. But he is right that it's important for the Senate to work on making those deductibles affordable as well. And at the website of our think tank, freeop.org, we've put out a proposal to do that, to create a fund, a block grant that states could use to provide health savings accounts or other mechanisms to help those low-income people afford those deductibles.
Why not push it back to the states, Jonathan? I got to go, so I need a quick answer here. But why not not push the block grants back to the states, let them manage the money on their own, and find some savings in that program by having it closer to home?
Look, I have no problem with giving states more control. I think that's fine. But the difference is you're mixing up state control with cuts. If you're going to push it back to the states, you have to with sufficient funding so they can actually do what Avik said and protect low-income people. A massive cut is not giving flexibility to states. It's just a cut.
Well, it's a decrease in the increase in spending over years. It's not a cut out of the gate. It doesn't happen for at least a decade. So they have plenty of time to manage that over time. Gentlemen, I got to leave it there, but I hope you come back. It's an important debate, and I thank you very much for being here tonight on The Story.
Thanks.
Thanks, Martha.
Thank you, gentlemen.